If you have no background in healthcare, it's going to be a long journey. Why should somebody go to a doctor for a flu? Doctors will not lose their job because of AI. Most of the time, digital health solutions are not quick. ChatGPT should be a part of the metaverse. I think it is a huge challenge.
Hi, this is our new episode of Digital Health Interviews. And before we start, I want to say that the war in Ukraine is still going on, so please support Ukraine in any possible way. And we'll talk a bit about Ukraine today as well. But to start with, I'd like to introduce our today's guest. His name is Philippe Gerwill. Hi, Philippe.
Nice to meet you.
Nice to meet you as well. Let's start with your short introduction. Please tell us a bit about yourself.
So that's already the biggest challenge for today. The introduction. At my age, with 30 years, at least in the industry, is going to be a challenge. So I spent about 30 years in the industry. I would say half of it, 15 years in the specialty chemicals and 15 years in the pharmaceutical. I'm actually already on early retirement from Novartis. But again, I started even before that, to focus more on healthcare. Especially digital healthcare. It started with all the technologies that you see for the moment around, like blockchain, IoT, whatever you want. But I have a lot of roles now as advisory. So I'm executive advisor in many different companies. I also do a lot of keynote speaking internationally, in many different countries. And again, mainly around healthcare and digital healthcare. One of my latest hot topic is healthcare in the metaverse. I'm just coming back also from Dubai, where I had 2 talks about that. But I think that's in a short summary. But I think my key point is I'm at the age now where for me it is also very important to give back to the community. So I really try to support the younger generation, startups, younger people. If we come to the topics, I might also have, some amazing talents in my network, 15, 16 years old, where I'm really amazed about, that younger generation.
Amazing. Especially the part about giving back to the community. Not too many people are willing to do that. Before we get to talk about the metaverse and all that stuff, since you worked a long time for pharma, can you tell me how pharma is actually adopting new technologies? Are they actually willing to do that? How are they cooperating with startups?
I think it is a huge challenge. I think most of the big pharma are actually trying with more or less success to cooperate with startups. And sometimes it is very challenging because the culture, of course, is very different. So the big corporation, I think also, I think one of the main points for startup is they are flexible, they are agile and all that. And these are, sorry to say that, but these are all the kind of quality that the big pharma don't have. They are very conservative, a lot of consensus. You talk a lot before you take a decision. And I would say today, unfortunately, the things are going quicker. So there is a need on the market for quicker decision, so it's challenging. But again, it's very different from one pharma to the others. We have a lot of pharma doing their own hackathon and stuff like that. So they are opportunities, but sometimes they still think about the startup in the mentality of big corporation, which is not the case.
All right. I know that lately you've been connected to Ukraine more than before because you became an advisor at the board of a digital health startup called DeHealth, which originally came from Ukraine. Can you tell us a bit about startup and how you try to help the founders?
So I think, again, the main reason why I joined DeHealth is exactly because of what you said, because they are from Ukraine. That was the key driver for me to feel like sorry for them, and I have to help them, to do whatever I can to help them, because they have done already an amazing job. They had millions of users, thousands of doctors and hundreds of hospitals already onboarded on their solution, using their solution. but it was in Ukraine. And then the war came, so I really felt sorry for them and say, look, I have to do something to try to help them to expand in other countries. Anyhow, these kind of solutions are usually still have always a big portion of local things, being regulation, whatever. So you still have, although you have maybe technically a global solution, you have to address it country by country because of the regulation. We talk about, sharing data, electronic health records and all that stuff. So sharing this data is always linked with local regulation.
I'll definitely at some point, I'd love to talk to the founders of the startup and get some interviews and talk about their product. But again, thanks for helping Ukraine in any possible way you can. You're an advisor to other projects as well. Besides this example, how do you choose the companies you want to help?
I think it's coming from both sides, of course. It's coming from the company and from me. Mm-hmm. But of course, it is always very important what is their specificity. Because, if you look at my profile, for some people, I might have too many advisory roles, but for me, it's like a puzzle. They are pieces fitting together. Usually, they are not two companies doing exactly the same. So there's always something which I think you could pick from one or the other. Mm-hmm. And again, I'm a big believer into the ecosystem. Even if I'm coming from a big corporation, that's maybe exactly why. I'm a believer in this ecosystem where you might have different companies doing different things, and for a specific project, you can bring them together. And it's not because I take these 1, 2, 3 companies that the next time I don't take another one. So it's really on purpose where it's the best model for deliver in a specific country or whatever. I pick these different companies. Now, I said also the other side, all of them have something special I'm interested in. So recently I joined the board of a company who is, for example, focusing on conversational AI. Before that, there was a company so that company I mentioned was in India. I joined another company in Hong Kong who is doing more the metaverse, not in the healthcare, mm-hmm. but metaverse expertise. I'm also a mentor for incubators in UK, in Singapore. So I really think it's also what they have. As I gave these last 2 examples, in India and Hong Kong are really specific things, So sometimes, and I think I can give them opportunity to add that expertise to another bigger ecosystem.
That's really cool. So you focus a lot lately on emerging technologies that aren't massively yet used in healthcare. You talk a lot about Metaverse, ChatGPT, of course, blockchain. Which out of these 3 do you think might have the biggest impact on healthcare in the nearest future?
So first of all, I think even in general, and I think even before when I mentioned IoT, so we talk about AI and other stuff, I think it's a time that we don't think in silos, that those things are coming together. So I may even not answer like you asked about putting them in competition. Is it more ChatGPT, is it more Metaverse? Mm-hmm. At the end, I think it's all coming together. So let's start maybe with blockchain. I think for me, my focus on blockchain was never really on cryptocurrency, because for me, cryptocurrency is just one use of the blockchain technology. But the blockchain technology is for me just the basis of Web3. So I think it's a technology. We talk about immutability, decentralization, and all that stuff, which is going to be the basis of Web3. So for me, at a certain point, even maybe we should not talk about it, because it's just a technology like you had HTML or whatever before. So it's a must for me that if your application is not working with blockchain, you might not have a Web3 solution.
Okay.
Then if you go to the metaverse, that's one of my latest topic, mainly on healthcare and metaverse. Maybe we will elaborate more on that. But ChatGPT, I just recently wrote an article about that, because for me, ChatGPT should be a part of the metaverse, because in the metaverse, we talk about virtual avatars or whatever, and who is going to make the conversation for those avatars. So there will be, especially if I talk about healthcare, is about having a conversation with the virtual doctors or virtual nurse or whatever. So who is going to generate the dialogue, the content of that discussion? And that's where I'm welcoming, technology like ChatGPT, which is coming, quicker than a lot of people were expecting, but really to provide that kind of content. So really have that natural language. And even we didn't mention, ChatGPT has another advantage as well in terms of the languages. Mm-hmm. So you're not limited to English or whatever. So I think this is a big step forward, in the technology to apply that even in a healthcare for metaverse like that.
When we talk about ChatGPT, and everyone is talking about it, of course, lately, in terms of healthcare, the biggest problem I think right now is that it teaches itself based on the data that they're feeding the chat, and it's really hard to validate how truthful and correct the data is. So do you think that might be a challenge for actually integrating chat into healthcare? Because, if I ask chat to give me the recipe of a soup, and if the chat messes it up, probably nothing bad happened to me. But in healthcare, if the chat is using not really valid data, that might be a problem. How are we going to solve this?
In my opinion, you have to put it back into my thinking, which is about removing, releasing some more time from our HCPs. So they don't have enough time. So whatever I can remove from them, is valued time that they are gaining. So the point is not about the complex tasks for ChatGPT, mm-hmm. The simple things. Even moving the point of care, why should somebody go to a doctor for a flu? So I think giving recommendation for a flu is not an issue for ChatGPT. If you talk about cancer and other things, that's clearly they are symptoms and diseases where you have to go to the doctor, and that's why we need the doctors. But if you keep the doctor busy with paperwork, that's one of my other favorites, the paperwork that, the HCPs have to fill and all that, or even entering data for the electronic health record. Today, most of the doctors, they are not looking at you anymore. They're looking at the screen. I want the doctor to be back as a human, who is looking you into the eyes, who is talking to you. And that's only possible if we remove all the other tasks for him. And that's what I'm saying. I agree with you. ChatGPT cannot, although some people may argue saying, they be giving better results than the doctors and all that. I don't want that competition. That competition is not healthy. Mm-hmm. Because it's building a gap between, the doctors and AI. While AI, and I always said, for me, AI should not be artificial intelligence, should be augmented intelligence. So to help the doctors to get rid of his burden to do that. So ChatGPT really involve and maybe do more in the future, but let's for the moment still concentrate on simple tasks. Why should we not use ChatGPT for simple tasks? And I think that ChatGPT can do without being more dangerous than your soup.
Very good. I agree. All right. Let's get back a bit about Metaverse. Recently at Malta Week, you were a moderator of a special panel session called the Healthcare Metaverse, the Good, the Bad, and the Ugly. I understand that it's quite difficult to retell everything in some sentences, but let's speak about your conclusions on this topic. What is good, what is bad, and what is ugly in the Healthcare Metaverse as you imagine it?
Yeah, I think that was back in November, and as I said, things are going so quickly, that recently I was in Dubai, I talked again about the Healthcare Metaverse, in March, and again, it's an evolution, things are going so quickly, but at the end, my view of that is still coming together, about the same. So really, those topics, they are good things, they are bad things, So the good thing, as I said, is still going to direction, to remove the point of care. What people could do on the metaverse, in an immersive way, in terms of getting advice, recommendation. And don't forget, the metaverse is not just about doctor and patient, it can be community, patient with patient. Or if you talk about mental health, where we know that we have already technical solution, with VR and all that, helping, pain management, anxiety and all that. But there's also a point, one of the most important point with talking with doctors and all that and patient is trust. But in things like mental health, we have another issue also that people don't want to talk. They are afraid or they are ashamed or whatever. So maybe talking, on the metaverse and not to a person in that case could help. So there are many different opportunities for that. But again, my key point in Dubai with metaverse was actually, I took an example about gaming. So the gaming metaverse did a lot, and thank you for that, in terms of technology.
Mm-hmm.
But do I want the same metaverse for healthcare? Do I want to talk about weapons, blood, addictions? So I said, technologically, thank you very much for the advance that were done there, but that's not the metaverse I want for healthcare. And my topic in Dubai was, healing the metaverse. I need a healed metaverse for healthcare, not a sick metaverse. And that's the point where I'm saying, that the border is very thin from one to the other, between the bad and the good. And of course, we may talk about regulation, ethics, and all that, which have to come into that. I definitely support that we need that, but I'm also afraid that if we talk about all that before, we will talk more instead of doing. We have good example in EU that it can take years. GDPR took 6 years, 4 years discussion, 2 years to implement. So I'm not saying GDPR is bad, but 6 years to decide something in today's pace would be a nightmare.
Concerning Healthcare Metaverse, you have a regular newsletter with articles on the topic. Which one caused the biggest feedback?
I don't know if it was because it was the first one or because of the topic, but the first one was about the healthcare metaverse in China. Mm-hmm. So that one which was getting the most comments and all that. So I said, I still don't know if it was because it's my first one or because it's China. Because, of course, many people are not aware what is going on in China in that space, especially with the recent, political discussion, we are focusing on ourselves and not really what's happening there. And again, from a technology point of view, huge things are happening there too. I mentioned before, the gaming industry. So, of course, gaming is something which is different in China. It's even very controlled now by the government in terms of how long the kids can play. But the whole things about, key opinion leaders, online marketing and all that is at the other level in China. So the metaverse is, of course, already used for that. So that's the point. Now I think the others were quite, different topics. I talked about patient community in the metaverse. I talked about the medical tourism in the metaverse. So some of them are really controversial. Like I think that the medical tourism in the metaverse is a special topic because initially you think, medical tourism is very physical. I need to go there, even if you include wellness and spa topics, that's something I want to smell, I want to feel. Mm-hmm. So how can you say we can do that on the metaverse? So I think there are many opportunities in many areas. Just imagine that the medical tourism, for example, was probably one of the most touched industry in the healthcare because like tourism was into, when there was no travel anymore. So you had tourism and healthcare, that was a big hit. So some of the companies that are restarting now are clever and try to restart differently. That's why the metaverse discussion is open with some of those companies because they understand that maybe we could do it differently. So I don't want to go too much in the details. I don't want to talk about the content. You can read the newsletter if you want. But now also the last one I wrote just this week about ChatGPT and metaverse is of course also something which is getting some reaction because again these things are coming together. So again, that newsletter is still I'm still in the phase where there are not a lot of people talking about that. Healthcare in the metaverse. There's a lot about metaverse, but healthcare in the metaverse is a special topic. But in my network, I have a lot of doctors. And that's what is important for me, that those key people are embracing that discussion. And again, it's newsletter, but it's the same with some of the meetings I had 2 weeks ago, where really researchers, scientists, doctors are interested in the healthcare metaverse, which I was surprised by myself. Because initially I was thinking, what are those guys? That they are talking about molecules, about cutting, about dentistry, whatever. Do you think, I even didn't give a thought, but if I give a thought, I will find an opportunity. But, why should dentistry be interested in the metaverse? I don't think you can change your teeth or whatever in the metaverse, but I'm sure you will find some other cases. And the key case for me, again, is about all the example where you don't have to go to see physically, moving the point of care. So not going to see physically your HCP. And the same is also, I know nobody who likes to go to the hospital. I think everybody has an anxiety, not the best moment in your life and whatever. So even that anxiety you could work on in the metaverse. Like, visiting the hospital before, talking to people, on the metaverse about that. So then when you come to the facility for your surgery, you're already familiar with it's a familiar place for you. It's not something you don't know where is what and all that kind of stuff. Same you could imagine with the dentist. You could also visit the dentist and all the tools that he's using before. And then when you come, you're not surprised that, you get into that room, or you get a X-ray or whatever. So I think whatever you touch, I think there's an opportunity for metaverse. It's just maybe smaller or bigger.
Okay. And I will definitely put the link to the newsletter, Philippe's newsletter under this video, and I highly recommend to subscribe if you're interested in all the metaverse going on in healthcare, and we'll definitely get there at some point. I really hope very soon. I wanted to ask, how do you see the relationships between patients and clinicians and their expectations changing over the next few years?
I think it's not an easy question, but I think it's becoming closer and closer. But on the other side, it's always, as I said, we still talk about individuals. So not everybody is reacting the same way. And I think that's why also I want to give more human time back to doctors, because sometimes it's about these human connections. So not everybody is just a robot, and you can deal with everybody the same way. And that's where today I see a big gap. Sometimes I have the feeling if you go to the doctors, it's like at the American border, next. And that cannot be, because that human time, and that's why I hate so much this competition. Some people are entertaining between doctors and AI. It's not a competition, we need doctors. They are not going to lose the job. And again, yes, there is a saying actually because of ChatGPT, that, doctors will not lose their job because of AI, but the doctor that use AI will take over the doctors that are not using AI. And I think that's the point. We should not be afraid that technology should help, will help. So again, the same on the other side. There is not one simple answer to your question. Depends also about the disease that you have. What you're sick about. There are things where sometimes a community may help more than a doctor. And then there are examples where the opposite. What I'm saying? Sometimes a patient is trusting more another patient that is having the same disease, went through a certain experience, than a doctor where he has the feeling, he has not my pain, he's not feeling what I'm feeling. So I think that's not black and white, it's difficult, but that's what I'm saying. For me, here we talk again about humans. That's the point, and that human time is unfortunately decreasing, and I want that human time to get back on track, so that you can handle people differently because they are people.
Can't agree more. At the very end, I ask our guests to give some kind of recommendations to startup founders in digital health. What kind of advice would you give them?
That's a good question, because recently I had ups and downs in that space, where sometimes I was surprised, and I'm not going to put names on it. So first of all, as I said, probably with COVID, there was also a booming in terms of interest for health, and then of course digital health. Because I'm sorry to say that I still think it's easier to provide digital health solution than real health solution, like doctors and all that. You need more doctors. It's going to take 5-10 years to get more doctors. A digital health solution, I can be quicker. So I think that's that aspect. But the problem is, on one side, there are huge opportunities, but there are also many startups going to that direction, and it's always not, if you have no experience, it's different. It's difficult, because sometimes you're underestimating regulations, validation, you need clinical tests depending what you're doing and all that. So the whole topic of validating a digital health solution is not that easy. It's, again, as mentioned earlier, is also different from country to country. And I have also seen, and that's what I'm saying, I'm not going to give any names, incubators that are now discouraging startups to go into the health direction. Because, again, those incubators, they want to be quick. They want quick return, they want to be quick. And I'm sorry to say, but most of the time, digital health solutions are not quick. So sometimes I'm happy, sometimes I'm not happy, because an incubator who has a worldwide presence in many different cities, discouraging now their startups to go in that direction. And luckily, I know that, because some of the startups are still coming to me and say, despite the fact that they don't want us to go into healthcare, I would still like to have your feedback, your support, and what we should do. So again, I think really for the startup, on one side, it is not easy. On the other side, I think this digital health market is huge. And that's why I'm working for different companies, as an advisor, because I think there's still enough space there will not be one taking over everything. Even if you talk about the Google, Microsoft, Amazon, going now into healthcare and all that, they will not eat everything. So of course their business was always around data. So of course the whole data piece is one of their key specialty. But I think there's still a lot of space, for startups in the digital health. And again, I see opportunities popping up every day. The thing is just keep in mind that it's still not easy. If you have no background in healthcare, it's going to be a long journey. Because you think, I can implement a digital health solution like I implement, a food delivery service or whatever, and that's different.
Okay, thank you very much, Philippe. That was a pleasure talking to you, and really excited to hear all the news about Metaverse and how it's going to get integrated with healthcare very soon.
Thank you very much, Yor, for giving me that opportunity, and it was a very interesting discussion.
Thank you. Bye-bye.